Hey, what's up? Welcome back to Mental Edge Training Coach here with Chad Hermansen. Today, we're going to be talking to a psychiatrist. We're going to bring a psychiatrist on board today, Dr. Mark Allen. I just met Dr. Mark Allen a few weeks ago. Great dude, has some great insight. We're going to talk to what I would deem as one of the guys back when I played that I would be very reluctant to talk to, right? I don't know if I want to talk to a guy, psychiatrist. What's wrong with is there something wrong with me? Like, why do I need to go see this guy? So we're going to have a conversation with him, talk about, what it's like to come to a psychiatrist as opposed to maybe a mental skills coach or a mental performance coach and what the differences are there. So enjoy this conversation with Dr. Mark Allen. All right, Dr. Mark Allen, how we doing, sir? Welcome to the Mental Edge Training Coach podcast. What's going on?
I'm doing great. Thanks so much for having me on, Chad.
Oh, it's my pleasure. We met a few weeks ago, and so we were discussing a couple things. We met through a mutual friend who was a former agent. Had an awesome conversation about kind of what you do, right, as being a psychiatrist. And so once we started talking about, hey, let me have you on the show, my initial thoughts were, okay, so I'm thinking Chad Hermansen 20 years ago is 21 years old. Probably could have really used somebody to talk to in regards to I feel like I'm kind of going through some stuff. I don't feel like I want to go to a coach or a manager. Um, Basically, I want to go to someone that's qualified that I could just sit down and have a conversation with. And tell us how you got into being a psychiatrist and kind of where you're at right now with that.
It sounds great. Again, thanks so much for having me, Chad.
My pleasure.
It's a little bit like pulling back the curtain. It's not. We're just people. So psychiatrists by definition are physicians who
Hmm.
happen to go into med school, who then decide to specialize in the brain and mental health to kind of help the whole person. And psychiatrists are best used when they're thought of as kind of like consult liaison style people in a team setting.
Hmm.
Like one of the rotations we do in the hospital is actually to be sort of a consultant to an internal medicine team that's working with a patient. And then if there's a mental health concern that arises, we can help guide them on how to deal with it there. Um, how I got into this field is a long story. I will spare you. Basically, when I was in college, I was a resident assistant for freshmen, where I was basically given a bunch of guys in a hall and told to sort of mentor them. But then along those lines, you had to take a call, and overnight, very commonly, you would deal with mental health concerns. I thought it was super interesting, and I thought it was a really cool way to sort of give back. And then when I went to medical school, I actually thought I was going to go into orthopedics because I like sports, and I had a family member who had been a sports medicine doc years ago.
Hmm.
But then I found out real fast that all I liked about orthopedics was that a lot of the guys talked sports all the time and wore boots. Otherwise, I thought surgery was super boring.
Okay.
And I was like, maybe I should rethink this. So anyway, met my mentor in medical school, who is his name is Dr. Thomas Matthews. He's on faculty at the University of Texas Health Science Center, San Antonio. Anyway, he had this exact same personality as me. He told me, come under my wing and follow what I do. So to get to where I am now, I had to go to medical school. I had to do a residency in general psychiatry, which takes 3 or 4 years, depending on if you fast track. I did 2 years of fellowship in child and adolescent psychiatry up in New York City at New York Presbyterian. And then after that, it was game time to actually like work with patients outside of a training setting. I met my wife in Texas, and we decided to go have a little bit of fun for a year after training while I worked. But we moved to New Zealand, and that was super cool. Down there, aside from the obvious hiking and nature-filled activities that we got to do, I was able to work in another style of healthcare system, which was eye-opening to me.
Mm.
And I actually got some extra training down there in eating disorder work, which ended up becoming sort of my subspecialty. So flash forward to returning to the United States. I came back and actually took a job in the state of Maine, which shout out to my Mainers. I love it. Gorgeous. And
We
it's
got a
even
lot of
nice.
Mainers listening to this, I'm
Yeah,
sure. Yeah.
it's even nice in the wintertime, although I feel for the recent -50 degree temperatures. Um, So it worked up there for a little bit, and then eventually came out to Colorado, where I'm talking to you now here in Denver, to take an eating disorder job, and now I've opened a private practice. So boom, that's sort of the
Yeah.
way I hear. But as far
Yeah.
as the sports world, let me give you a little bit of background on the difference between the different specialties.
Yeah,
So
please.
for years, sports medicine has the inlet to it has been to either go into primary care sports medicine as a family medicine doctor. So just think of the old school general practitioner who would work with your family, all ages, all comers, you got it. They just happen to also have a one of the ways you could go into sports medicine was through that, or orthopedics.
Yeah.
Those are kind of the two big ones. They kind of always didn't really focus on mental health. Maybe they did at the bedside, and a lot of these people were really good with working with their patients, but it never was on the forefront. Sports psychology has been around since the 50s, and they're well entrenched in the academic community. And in fact, they've developed even their own subspecialties. There's now something called a certified mental performance consultant, or a CMPC, that you can get as a sports psychologist. Those aren't physicians. That they certainly work within the sports medicine space, and they have a very important role. And in fact, because they've been around for forever, they're good at their job.
Mm-hmm.
But what they don't necessarily have in their toolbox is having gone to medical school and seeing things from the doctor's perspective, working with patients and all the different body systems and how that really interrelates.
Yeah.
So where I'm going with this is, yeah, a sports psychiatrist is someone who kind of looks at a biopsychosocial model. That's our gobbledygook way of saying looking at the whole person,
Right.
and looking at an athlete and how to help them from head to toe, and checking out those invisible injuries that can occur on the playing field, because you can't see when someone's being bothered by anxiety, depression, or whatever. So that's what I do.
Yeah, no, that's awesome. And we were talking a little bit about, we were in a way planning out what we'd want to discuss today, and obviously we can go in so many different directions. But again, like, so back to when you work with an athlete, right? And an athlete might come to you, and I'm assuming, what is there a typical age that you work with? Is it teens? Like, where are you at with that right now?
It's a good way to put it. So there's two different probably ways in which you can get a referral. There's the working directly in partnership with a team or an organization,
Right.
say the team psychiatrist for X organization, or you're a consultant, or you're getting referrals from like a primary care sports medicine clinic or a sports psychologist in the community to see a patient who needs a mental health evaluation or workup. For me, it's the latter. I'm not directly attached to an organization, but I certainly have my mentor, Dr. David McDuff. He works with the Baltimore Orioles, formerly with the Baltimore Ravens, and he kind of was the I hate to say this, sorry, David, but you're kind of the grandfather of sports psychiatry. Everybody respects him, and he's been doing it since the mid '90s. Basically, when a little bit about him and how that all comes into fold, since he's really blazed a path. So when the Cleveland Browns moved to Baltimore, he was the addiction psychiatrist attached to the University of Maryland, and he basically got into this role. He was was connected with the management at the time, and he had been in the military, and it was basically transitioning his military model of a team psychiatrist, and did it for sports, because there's a lot of blend, or I mean, you can imagine crossover between the military and the way sports organizations function. From that, he actually wrote a really good book called Sports Psychiatry: Strategies for Life Balance and Peak Performance, giving him a little bit of a shout out.
There you go.
And he and a few others, including Dr. Claudia Reardon, created this organization called the International Society for Sports Psychiatry, which I'm a member. It's basically super niche, but they had this mentorship program. So he has sort of really perfected the team consultant model. And then there are others in the community like me who are actually see just athletes of all ages. So you asked me what ages I see. I'm a child and adolescent psychiatrist, but I also can work with adults. So that's my wheelhouse, and the most common age of patient is going to be a kid who's probably between 14 to 25, So you have someone who's about to take a jump in the level
Mm-hmm.
of sports. So you can clearly they have some talent. They're wanting to go to maybe an elite level, either to college or to make the next jump. And there's something that's holding them back. And then the question is, where's the referral coming from? Is it the parent? Is it
Right.
the kid? Is
Right.
it the coach? Because the family system in an athlete, especially kids, is bigger than just mom, dad, kid, sibling, dog, or whatever. It's the coach, the pitching coach, the hitting coach, the trainer. It just starts to expand in this system. You actually have to learn how to meander. So anyway, does that help you a little bit?
Yeah. And that's kind of thing, right? Where you have, and I was kind of thinking in terms too of like the players that I work with, almost 100%. It's coming from a parent that reaches out. I've actually had coaches, right? They're like, "Hey, I got a guy that I think you might need to kind of work with here." So the parents are kind of recognizing, or the coach is recognizing something might be just a little bit off. Person might need a little bit of help in that regard. And let's just say like a teenager, like high school baseball player, right?
Yeah.
What would you find is are there main things that parents come to you, hey, my kid is struggling with A, B, and C. What do you see there?
So again, it's you have to really tease out who's wanting the consult. Is it the parent who's over identified with the kid, or who
Mm,
can see the potential in the kid that's just not coming out on the field? Because the reason you come see me is not necessarily because you might think that it's a performance issue on the field, that there's just going to be some gimmick that I can teach you, or like a sports psychologist could teach you, but you have to peel back the layers of the onion and
mm,
figure out sort of what may be holding them back. But yeah, the most common thing is the parent would call, and we'd come in, and I would talk to kid first. If they're the old adage is 13 and up, you talk to the kid first, separate from family, then talk to the family alone, and then you bring them in together. Below
mhm.
12, you would meet with the parents first to have a better understanding. But the if it's I like it the best when the kid has it in their mind. They have the insight of, maybe, okay, I got the yips.
Mhm.
I know I have anxiety. I know I have this block, but and then we go down the rabbit hole a little bit and realize that maybe it's been more of a generalized anxiety picture this whole time, that is just now somehow manifesting on the field in a bit of panic. And it's
Sure.
taking, they're getting that analysis paralysis where they're stuck and they can't make the throw from second to first, like Knobloch or whatever. And yeah, so we can kind of work through that.
So it's funny you bring that up. So that was me, right? So I developed that in it's kind of funny. In a way, I felt like I've always had a portion of it, right? I was a kid that always could throw hard, had some velocity to my throws, and move from the outfield to shortstop. And now I got to be really accurate. So kind of a little bit in high school, and then it started to get really bad, in the minor leagues when I'm 17, 18, 19, 20, kind of in my early minor league career, all the way up really through AAA when I played the infield. And what is it, do you think, so when a player comes to you, has the yips, right? What are they telling you? How can you treat that?
So it's tough. Mostly because there's no overnight fix to the yips, other
Yeah.
than to get them to gradually understand that it's that internal dialogue that they're telling that the brain doesn't work as fast. If you're actually thinking,
Mhm.
it's slower than the motion. If you're now focusing on actually releasing the ball and throwing it to first base, and you're thinking about how to do it as you're doing it doesn't work as fast. So you have to learn how to quiet the mind. Now,
Right.
mind you, there's lots and lots of different books that discuss different tactics like that, and
Mhm.
we can kind of work on focusing on a lot of breathing techniques. But notice, I'm a psychiatrist. I've not talked about medication, and there's not.
Right.
I'm not just going to throw a pill at the situation.
Mhm.
So part of the thing that really, I think, prevents and or scares people about coming to the shrink
Yeah.
is that they don't quite understand that we actually think about the whole person, and that really the movement in psychiatry over the last 10 years or so is not necessarily away from medication, but really adding some of the tools that we used to have that we'd given up to the psychologists and decided to marry the pharmacology industry, which is awful. So we're thinking now again, not for the first time, but again about healthy nutrition and sleep and basically lifestyle maneuvers that are people sometimes forget to do because they're in the hustle bustle of their day.
Well, yeah, and so the overall performance of taking care of yourself, right? And I can't even imagine where I'm so grateful and thankful that I didn't have a cell phone growing up, like at the high school level, right? And because we actually kind of try to implement when I have four kids and two were in college, one's in junior high at 8th grade, one's in high school, and so the ones that aren't adults yet, right? We're like, okay, well, 10 o'clock, it's bedtime, right? And 10 o'clock, you're bringing your phone into our room. We have a little thing for the wall, and the whole point of is that like you need sleep, right? Sleep is so undervalued and underrated, and when you don't get sleep, right? And you're like, it's like I know for myself, I need 8 hours. That's my lucky number for me.
I need 8 hours, but my 8-month-old won't let me.
Yeah, you're a different phase, right? So good luck with that.
Yeah,
right?
yeah.
Yeah, you get thrown around a little bit when you're kind of more on that natural pattern, right?
Right.
So that is essentially a tool, right? That sleep is, you got to recover, you got to it helps with your mental health and your mind and getting into those routines, right? But yeah, you brought up the point of just the name and the title psychiatrist. So I think that's what would, back in the late 90s, early 2000s, would kind of in a way scare people. Because we would think like, well, what's wrong with me? Like, why am I, anxiety wasn't really talked about as much back then. I think we knew that was there, right? But like you were saying, would you say most of the diagnosis of like, hey, let's throw a pill at it, would a lot of it is based on the anxiety portion of it?
Well, so a lot of the gravity towards the concept of medication and why that became more in vogue back in the day, it was looking for that overnight fix. And we're in very much, we live in the United States, but this is also worldwide. The United States, people tend to be kind of have a short attention span and want things now.
Mm-hmm.
And they seem to think that that the medication would be a quicker route. But the fact is that almost all studies related to management of anxiety and actually getting it treated find that therapy plus medication actually leads to the quickest and best results. But therapy alone works about the same as medication does.
Okay.
And then if you actually look at exercise, if done correctly, can also have roughly the same form. So if you do everything and you address the lifestyle modifications, and boom.
Yeah.
Did I answer the question? I was kind of.
Yeah. So just basically, like I can only speak for myself, and kind of what I think I might have went through is just high anxiety, regarding performing, and without really being diagnosed with anything. I would guess if I went to talk to somebody, be like, dude, yeah, you're super anxious and it was really about aspects of the game, right? For me, it was like fielding and throwing, right? But not necessarily hitting. So it's kind of interesting.
Anxiety, in my opinion, tends to be sort of overlooked by a lot of different folks because they see mood symptoms erupt and maybe not realize that it's someone who's been taking it like a balloon, and letting air out, boom, explosion, reactive anger.
Okay.
I think maybe something that would be helpful to discuss would be like the onset of different things that may arise over time.
Yeah.
So like before puberty, the most common things that can erupt are developmental issues, anxiety, and ADHD. Those three things. Those are the most common stuff that we see in the clinic. Then you get the rush of hormones around puberty, and those you start to see mood disorders erupt. And then you have kind of the adolescent behaviors of like limit testing and being a little bit more independent. And then you can see some substance use dabbling in later in the teen years. And then finally, as far as the onset of things, you can see some psychotic illnesses erupt in the late teens or early 20s, or major mood disorders like a bipolar illness. Okay. That's sort of the order that we'd see the onset, but at any age, you can see anything, especially after puberty. So which is why a lot of times anxiety can get overlooked. In sport, athletes are humans. And so the prevalence of mental health conditions in athletes are roughly similar, except in a few key areas. ADHD is overrepresented in athletes. If in fact, if you look at, which we'll get into in a second, but if you look at therapeutic use exemption rates, and like in Major League Baseball, it's around 8%, which tracks with what you typically see ADHD prevalence rate in the athletic population.
Okay.
But you see more eating disorders in athletes, and you tend to see fewer, which sport being protective for suicide and also being protective for substance use, except in a few different sports that are sport specific. Otherwise, you see roughly the same mood disorder, anxiety, all the prevalence rates about the same in athletes.
Okay.
So it's what would come to my clinic. I might see a little bit more of a couple of things I mentioned. With my eating disorder background, that definitely is something that comes up, because if you think about it, a lot of sports are either weight based, like rowing, for example, trying to cut weight for boxing or wrestling,
Yep.
and aesthetic sports that really gravitate towards leanness, like gymnastics or dance, those kinds of things.
Okay. Yeah, sure. Sure. Yeah. That's, and you mentioned, we talked about this earlier, TUEs, therapeutic use exemptions. So now correct me if I'm wrong. So I was thinking Major League Baseball, for example, a player that has ADHD, they get an exemption to utilize and take that, some medicine, if you will, right? So how does that work? Is it, you said a small percentage is typically utilizing that?
Yeah, right. So about 8% of Major
8%.
League
Okay.
Baseball players are granted a therapeutic use exemption. But so the concept of a therapeutic use exemption goes back to the needing to find balance of clean sport, level playing field versus the needs of the athlete, and for the athlete to actually be able to participate in sport in their correct frame of health. So if there's something that they actually need to take to be okay, and this isn't just like ADHD here. I mean, like, for example, there are some blood pressure medications, insulin even, that require TUEs that, and a person who does not have a medical illness that requires those meds could be used for performance enhancement. And so, like,
Yeah.
for example, shooting, like riflery, those guys and women tend to, you know, they're trying to actually pull the trigger in between heartbeats.
Mhm.
So it would actually be to their advantage if they had a medication that slowed down their heart rate, they'd have a little bit more time to actually squeeze the trigger. And so, and it wouldn't actually jostle what
Okay.
they're trying to do.
Right.
And which you wouldn't think that a beta blocker like metoprolol would be banned, but yep, it is. And
Okay.
so anyway, if someone comes in my office, especially like an elite athlete, one of the first questions we need to like ask ourselves is, all right, one, are we looking at a medication? Two, is that medication on the banned list? Let's go check the USADA or WADA website. USADA is the United States Anti-Doping Association. WADA is the World Anti-Doping Association. On there, they actually have the list that's updated every January 1st.
Okay.
From that, we would then just determine, okay, do we need to apply for it? And so let's talk about Major League Baseball. You used to play. That actually is even more layered. We would check the list. We would gather collateral information from different resources. Let's take ADHD, for example.
Okay.
You would want to, I would do a clinical interview with a patient. I would get information from the family and the school if it's a kid, but for a Major League Baseball player, they're going to be out of school. We're going to get this packet of information together, and we're going to apply for a TUE. Major League Baseball has a second level where then they'll do some more testing or require more testing to be done. And if at that point, if that committee chooses that they get, then they'll give the person a TUE and they can take a medication. In some instances, a TUE can be granted retroactively where they've been taking a med, realize, oops, I probably need to like tell people about this so that I don't get banned or have a violation. But and that can occur, especially like in emergent situations, or when they were maybe in a lower level of competition where it was fine, but once they made that jump, they're the rules restrictor. So anyway, it's pretty dense, but I will say that coming to someone like me, we can actually help walk you through that process. And teams, especially at higher level organizations, will have someone that will do it.
Gotcha. Okay. So now, kind of fast forwarding when I was thinking about the past in regards to maybe utilizing a psychiatrist or doctor, sports performance coach, something like that, we're obviously seeing a huge jump in the mental health arena in regards to teams taking advantage of hiring psychologists, hiring psychiatrists. What's the difference between, let's say, a psychiatrist and a mental health coach that's you mentioned the Orioles, like, so the mental health coach for the Orioles, right, compared to a psychiatrist, what's the difference there?
So and I don't want to speak because I don't work directly with the team. I can't give you such specific information except from what my mentors shared with me and other people I've talked to. But most organizations will have a psychologist, so a therapist, but a PhD level therapist who sort of is the team leader to a degree, who will have met with the players to assess who might be struggling or who might be able to do some work. Then they'll have mental performance coaches or coordinators that will actually do a lot of the work on the front lines, akin to like an athletic trainer.
Yeah.
And they'll do some of those skill building things, which I don't want to speak for you, but I would imagine in your role, we're all a part of a team here of the medical professionals. And then the psychiatrist would be the kind of, these days, still in a consultant role, soon to be an informalized role with lots of organizations as the sports medicine affiliated mental health person. So if someone is struggling with depression, anxiety, it has been recognized by maybe some preseason screening tools, which we can get into, then they can see them to do an evaluation and get them help.
Yeah. Okay. Yeah. That's kind of why I figured too. And just to give you an example, we were talking earlier, how when I got my certification through the life coach school, that was it was a portion of the training, was understanding what your, quote, scope of work is. Like, who do I work with? And because there are life coaches that work with certain aspects, say, like you said, eating disorders, right? There might be a coaching program for that. So, but also understanding, okay, are we dealing with somebody that is completely depressed? Are they not functional at all? Right. So kind of the not functional person, that's when we refer out, right, to a person like yourself and say, okay, I have a guy that you probably need to talk to. This is not what I deal with. Right. I'm helping you kind of move forward where they're going to evaluate you, diagnose you, that sort of thing. Does that sound about right?
Yeah, absolutely. So I can do a couple of things here. I can help with the diagnosis to really flesh out sort of what's going on with the player. If the acuity is high enough and it's not just an adjustment reaction to some stressor in their life, and they actually now have a biologically driven depressed mood or an anxiety a disorder that's not just fleeting and it's really stuck, or they have like OCD or panic, then I can actually help create a treatment plan that involves some of these folks to do, because it's not ignoring or separate from the work that the coach like yourself or a therapist is doing with the player to help them just with day-to-day and with their performance on the field. It's in addition to that, if I can adequately treat their depression, lo and behold, their energy improves, their sleep quality improves, their motivation to actually do the work improves, and then their performance on the field gets better, but their whole life is improving.
They're starting to function. They're starting to show up a little bit differently, right? And their mindset and the way they feel about everything is starting to align with, the results they want. Absolutely. What we talked a little bit about, spring training's coming up, right? I remember going into spring training, you would get a physical examination, like a doctor would come in, you have your trainers doing EKGs, right? They're doing kind of flexibility. I remember my last year with the Angels. This was even years after I had my labrum surgery on my shoulder. The late Dr. Louis Yoakum, I believe that's Yoakum, Dr. Yoakum. He did an examination on my shoulder and is kind of doing my flexibility, and he kind of looked at me like, dude, how are you even throwing with this nonsense? And But so there's the physical aspect of it, right? And now we're talking about, it's definitely being talked more about the mental health side. Are you seeing any movement in baseball from like you mentioned, your Orioles person, like you have your health exam. Is there any type of mental exam?
Yeah. So it's just funny. I mean, I remember being in school and, you'd have the preseason physical.
Yeah.
It wasn't a medical exam, but even the way they referred to it was a physical. The mental part was just ignored. Yes. So thank you for bringing this up. So in 2019, the International Olympic Committee decided that it was time to sort of wake up to the mental health aspect to sport. And they created a mental health work group. Within that mental health work group, one of those people was actually Dave McDuff, along with Dr. Claudia Reardon and a few others. A guy named Vincent Gudabarge, who's had been a professional soccer player, and then Brian Hainline, who's the chief medical officer of the NCAA. Anyway, they decided to put together this group to create to actually do something, not versus just talk and yes, mental health is important. They created a screening tool for athletes and for trainers to use called the Sports Mental Health Assessment Tool, the SMAT. They created the SMAT 1 this spring. Apparently, they're going back to Switzerland and they're going to update it and do the SMAT 2, the SMAT 2.0.
Okay.
I know that's because I just had the conversation the other day. What it does is it's something that can actually be just given at spring training to all the players as a screening tool to make sure that things are okay, and that there's basically evidence-based tools for them. Dudes can sit on the bench and fill it out, or around a table at lunch, and then they can all actually do it not together but next to each other and filling it out independently.
So they're answering questions on
yes,
like a test in a way.
yes, it's a test, but there's no passing grade.
Okay.
So once they fill out the form, it goes back to the trainer and then back to the mental health professional associated with the team. They look at the results, and if it does require a referral, they've identified it. The deal is you, as I said before, mental health disorders are invisible, and so unless you actually ask the questions, you're not going to be able to find them. And so once the athlete's been identified, you can get them help at the beginning of the season and then monitor the progress over the course of the season. The Orioles actually have a mental training log that I'm not sure if it's all the players, but certainly McDuff talks about how he'll do it preseason, in season, and postseason, and have like short answer questions where these guys are talking about their experience playing and off the field, and then how that it becomes fodder to talk about in therapy.
Interesting. The first thing that came to my mind when you said that, like, say you're in the dugout taking a test or just filling out the answers. What if they're lying, right? These guys are making millions of dollars, for example, right? They're on contracts, and I'm just thinking like a player right now, right? And I'm trying to make a team, right? I'm a minor league player. I play AAA, or I'm a free agent that's come over, and all these questions start coming up. And I don't have no idea what these questions look like, but I would have to imagine they're probably better about it now because it's more open, but I would have to assume that there's some questions that are not being answered truthfully.
So you bring up a good point, and the concept of confidentiality is important.
Yeah.
And also within a sports organization, it can get a little bit hairy when an athlete may not be really willing to share just how they're doing because they're concerned that it's going to get up to upper level management, and whether people say it or not, it may or may not affect their future with the team if someone is not psychologically minded or whatever.
Right.
So in these instances, one, a good mental health professional that's attached to a team should be able to pick up if the answers aren't matching what they're seeing.
Okay.
All right. But if the player really doesn't feel comfortable seeing someone that's attached to the organization, that's okay. They can talk to their agent and they can get a referral to a mental health professional in the community, like me. and so we can do it that way, but still be above board, and it's private, and the athlete can be taken care of still.
Yeah.
And it's not shared that way. I think things are changing, though. I mean, the organizations are waking up to the fact that, one, they need to kind of take care of their athletes, and that the performance on the field is better if their whole person's addressed. And so we're in that, we're moving in the right direction.
We're getting there.
We're
Yeah,
just not there yet.
and
That's
I
why
would
we're
have
having
to
this conversation. I'm so glad that we're able to talk about this.
yeah, and I would have to imagine, again, being in a player's shoes, that yeah, I'm gonna go answer these questions, and I might be super open, I guess, depending on how you are in that situation. But at the same time, that so in my mind, right, if I had to do something over again, thinking like late 90s, early 2000s, I don't know if I would have went to my team. I probably would have went through my agent that has connections, right, in a more private setting. Even today, like hitters, pitchers, they have their private coaches,
Sure.
right? Whether they're a hitting coach. Heck, we just saw Russell Wilson with the Broncos, right? Uh, Sean Payton comes in and says, "Hey, dude, all your coaches are gone. Like they're not going to be around us, around a team, around a facility." And I'm sure it's like, you want to do that on your own time, type thing.
I mean, even Tom Brady had the same thing with the Pats.
Yes,
The
yes,
TB12 method. Yeah.
yeah. So it's like you get it, and you understand it. I would understand that as heck. When I played with Sammy Sosa in Chicago for just a couple months, he had just a guy that was always with him. He would throw BP. He would like dress in uniform. And I remember coming over, I'm like, what is happening here? So it really felt like special treatment. And things I think were way looser back then in the day, where they would allow people to come in the clubhouse. I don't think they allow that much anymore at the major league level, especially with the incident that happened with the Angels. Like who knows what these guys are bringing in, drug dealers basically of some sort.
Yeah. Luckily, we're not in that business. We're in
Yes,
the
yes.
business of getting players well. Yeah. It's the issue with especially professional sport is that it seems to still be non-stigmatized. If you hurt your shoulder, you talk to your labrum, and you need to go see a medical doc. It's easy. You get a referral. There's no
Yeah,
questions. No one cares. People care about your well-being and that you're doing well. But the funny thing is the recovery from a labrum surgery, but really any orthopedic surgery, one of the biggest prognostic factors is mental wellness and how you're doing with recovery from injury.
yeah.
There was a study done like 14 or 15 years ago about hip surgery in military, and how that actually was true. So
Yeah,
it all kind of comes back to that. You can't ignore the mental side of it. As far as other aspects of athletes that might be unique as far as the athlete experience, and needing to kind of keep that in mind, would be the athletic identity, and when someone's career ends before they're ready, and now how they've been an athlete the entire time, and then that transition to just like falling off a cliff, like, okay, what next? So you
yep,
have to like prepare for that next phase while you're still in it. Or in recovery from an injury, so that you're not, that really being social and staying connected is the biggest way to do it. So if you're struggling with a mental health issue and you're not talking about it with anybody, then it's not going to get better.
yeah. No, and that's the hardest part, right? Is, let's say, if we just stick with, say, the major league player, these are kind of alpha males, if you will.
Oh, yeah.
We're the toughest of the toughest. We'll grind it out in the minor leagues, all those things. But there's also a fatherly figure or a softer side, to that person, and then trying to go be vulnerable with somebody else and just share. Not everybody likes that. Right? There's an uncomfort level that's like, but then once you do, right, and you get it out, and you just like, oh, there's like a big weight off your shoulders, right? It's like you're actually able to talk about it, and okay, this is my issue, this is my problem. Now what? Right?
Well, but
Help
I
me,
think that's,
sir.
yeah, but
Right?
I think that's why the best therapists or coaches, especially for like a major leaguer or someone who's been there, who automatically has an in, like for like you will have such a fabulous career because you had already done it, and then you imagine they'll already be able to trust you that, like, oh yeah, well, you were there too, so maybe I can talk to him. this is fine. He's not like my direct manager on the bench that, you know, is directing on whether or not I can play on the field. So, and then they'll be able to then share how they're feeling and then get the correct referral and get addressed.
Right.
Same with like the best EAP or employee assistant programs. Folks that are attached to organizations tend to have been either former players or had worked or had played in baseball. You know, someone like me, my career ended earlier than I expected, but I stayed connected from a fan perspective. But then I also went to medical school, and then that's why psychiatrists specifically, like you couldn't have been able to have done that unless you were some just absolute you know, awesome athlete who was able to then go back to medical school after having been in the big leagues. And there's a lot of stories of actually players who are doing that. Julius Thomas right now, the old tight end for the Seahawks and the Broncos, won a couple Super Bowls with Peyton Manning. He's now nearly a psychologist. And I mean, he's going to have a fabulous career doing that and have an immediate end with these high-performing athletes.
Right. Yeah, no, I just think it's cool that it's like, I mean, the word is human, right? We're all humans.
Yeah.
Like we're all trying to just perform in life, right? Perform on the field, perform with our family, right? Perform as a professional. And stuff comes up, right? Limiting beliefs, our doubts in ourselves. Are we even good enough? Right? Imposter syndrome, all that stuff. So it's all there. And I just think it's really cool that people are starting to be open about it and just discussing like, yeah, I'm not perfect, right? I have some things I need to work through, but I'm always trying to progress as well, right? And I'm open to having other people help me.
Yeah, and that's why it's so powerful when someone who's in the media limelight actually shares their story. Stories are more powerful. Like you when I mean, I think the tides really shifted when Simone Biles came forward during the Olympics. And then Kevin Love, the NBA basketball players, talked about his issues. And then Michael Phelps has talked about his. And so you have these big athletes who've talked about what's been going on inside, that, hey, you too can get help. It's you get the stories, the stigma will break. Psychiatry and mental health will become just part of sports medicine, and it won't be nearly as much of a deal. And then with sports being so macho and alpha male, as you put it, at least for the, you know, male sports, if we can hit it there, it will have this fabulous trickle down effect on the rest of society, and then mental health issues will just be more easily addressed and not so closeted, essentially.
Yeah, like you mentioned guys like Kevin Love, Michael Phelps. It's almost like you see a story, like you're scrolling through social media, and then all of a sudden a story pops up. They're like, you know, Kevin Love is working with a doctor or working on his mental health, and it's like, well, like why are people, you know, I don't know if they're shocked by it, but it's just like, yeah, like he's a human, right? He's got all these things that are probably going on internally. It's kind of how we're wired to. Yeah, if things kind of get in our way, we need some help to get through it a little bit.
The guy had a panic attack in front of 20,000 people.
Mm-hmm.
I think it was in 2016 or whatever. I think it was when he was on the Cavs. And it was at that point that he realized he needed to get help, and he's been very open about it. And there was a great podcast episode on Blindsided by the Players Tribune where he actually talks about that kind of stuff. And anyway, it's the more conversations that are had, the more we can actually pick at this.
Right. So something just popped into my head too about that same story. So being here in Las Vegas, I'm sure you've heard of the Drew Robinson story.
Yeah.
Right. And so a guy he tried to take his life, right? And was very close to it, lost his eye. What would you see, like, and I don't know the full story, but I know that I think there's some major depression going on, high anxiety, probably among many other things too. Why do you think a guy like him couldn't go talk to somebody before it got to that point?
So the problem with depression, now mind you, please understand, as a psychiatrist,
please teach us on this.
I can't diagnose from afar. I've never met them, but I can kind of talk about the situation generally.
Right.
Depression is isolating. It's like it's a black box. It makes you feel like you're alone, that you can't talk, or that no one else would understand because you're the only person going through it. And so it basically just puts blinders on and makes your environment very small. So in that setting, when you feel like you're alone, it's an irrational belief. So why would you be able to step out of that to then tell someone that you're struggling. So for someone like him who was having suicidal ideation that actually progressed, you know, you can't really say why he couldn't help.
Right.
But when you are getting warning signs and when people are around you, so let's talk about depression and like what
Yeah,
those
please.
are. So there's a great acronym, SIG caps. So sleep disturbance, loss of interest, guilt or unfounded guilt, loss of energy, loss of concentration, loss of appetite, or increased appetite, depending on the style of depression, psychomotor slowing, which is basically just feeling listless and restless, and then potentially suicidal ideation if it were to progress that far. So you have all of these like biological symptoms where your body's telling you you're depressed. And when you have, you know, no energy, can't get out of bed, don't care about the typical things you like anymore, the people who love you, assuming you're still socially connected with family or other people, they should be able to recognize that you're not looking like yourself.
Sure.
And that's when they really do need to step in to help you find someone. Within the sports atmosphere, on the field, it's like when there's a dramatic loss of performance that's unexplainable. When there's maybe overtraining that's been done, you're starting to be more prone to injury, or you're just not able to do things like you were. That's when the staff needs to like pull you aside and talk to you like, are you doing okay? Not what's happening, just how are you?
Right.
And then
just ask, right?
So it's just talking about it. So the common misconception is that if you ask someone if they're suicidal, you're going to make them suicidal. And that is just false. You have to actually broach the subject. It'll be a sense of relief that they can actually share.
Yeah.
You're not going to plant the thought. I can assure you that it is already there, or could be potentially already there when you're that low.
Yeah, and it's obviously very prevalent. Like I bet you can't really talk to an adult that doesn't know somebody that's either attempted or tried, or it's just gone through depression in general, right? And I would have to think that we've all, in some aspect, in some form, have gone through a little bit of it in some way. You know, like I know women could suffer through depression after pregnancy, you know, postpartum stuff like that, and so just being able to, you know, a friend of mine is a postpartum coach, you know, and just does very well with that. So yeah, it's just, yeah.
I was just going to say, after my wife had her baby, one of the best things the hospital did was it was just part of the process. Created a support group for all the women that were delivering over a period of time, and then they stuck together. Could I tell you that some of her best friends now are those that she had kind of gone through the trenches with right after delivering? And they go on walks with the kids and whatnot. I mean, it's like it's that sense of community.
Yeah.
But what you mentioned is it helps with that, the idea that everybody goes through stressful life events and disorders, that the mental health in and of itself is a 5 in 5 idea that versus 1 in 5. So you'll hear the stat: 1 in 5 people will have a mental health disorder over the course of their lifetime. Okay, maybe clinically significant, that's diagnosed by a professional, but I can assure you that everyone, 5 in 5, will deal with some kind of stressful event over the course of their life. And so you don't want to other them, make the people who have been diagnosed as feeling like they're different, because they're no different. They're all humans. And so assuming you think about it more broadly, we can be in this together. We're all on the same planet. Let's be a little bit more of a sense of community here and help each other.
Yeah. No, you're right. Yeah, you get in a little community or group, and an example, like I had a conversation with it's a former minor leaguer I'm talking to and working with, and we've only been working, we're on week 3, right, of a 6-week program, and we're like, he's like, man, this is interesting because you know you go through a playing career and you play with your teammates, and you know you play your game, you get there in the afternoon, you do your workouts, you play your game, and you go home. So you're there for however many hours throughout the day, and you do that all year. Some of these teammates you have, you know, you say you're coming up in the minor leagues, they might follow you each step. So you could be playing together for years, and yet you don't know anything about them. Like you don't go to lunch or dinner. Like they're not in your little group or whatever. You know, there's definitely groups in the minor leagues as you come up, and your buddy or best friend you hang out with. And you're like, man, I don't know anything about that guy. And he just brought up the point. He's like, man, I've been talking to you for 3 weeks, about an hour per call. And he's like, I feel like we're good friends now, you know, and just like, but just the fact of like talking to somebody and being, you know, whether it's a private conversation, but and being just okay with it and just letting out whatever's happening, um, and then actually doing the work, you know, working on the problem, having a little bit of a solution for it, and just doing some thought work through it, and checking in with your emotion, right, with what you're feeling about it. It's kind of fascinating.
I mean, you've gone through the trenches together. You're a
Yeah.
cohort. You know, as far as like the concept of team dynamics, a lot of times when you'll say at the professional level, mind you, this isn't really a psychiatry based discussion, but like you make a coach switch
Yeah.
mid-season and they have their own philosophy, and it might take some of the, and then they bring in some of their own talent, and then like it's a brand new year. um, there might actually be a drop in performance as everybody's getting used to the new dynamics of all the personalities. Whereas like you have the old core that really had worked well. There's like uh, countless examples of, you know, like a high school team that had worked together for a long time, that had done really well, and then they wanted to make a change of management, thinking that it was going to put them over the edge, and then the team ends up falling off a cliff.
Yeah.
So anyway, it's just yet another layer that not only do we have our own internal issues we're going through, that there is a social connectedness and interrelatedness that become a factor, especially within a team.
Yeah, no doubt. Well, Doc, this has been outstanding. We talked about is we'll kind of start wrapping this up in
Yeah, sure.
regards to, for when someone needs to come and visit or see a person like you, they actually need to get a referral, correct? How does that process work?
Yeah, I mean, to see someone like me, you can self-refer. You can go to my website, peaksportspsychiatry.com. But someone
Okay.
like a sports psychiatrist, or really a mental health professional in general, you can self-refer. You can go through your primary care doc. You can go through a psychologist or a therapist who might have connections within the community. For just even a kid in school, you could ask like the vice principal or counselor to help find someone. There's always a way. Um, if you were to go online, you can also get some mental health resources. There's also crisis line, like the new
Mhm.
mental health crisis line is at 988, I believe, where you can go to the emergency room. Like there are always ways.
Yeah.
As far as an outpatient, I think the easiest way, especially from a sports team, would be
Mhm.
to go to the primary care sports medicine doc, or to use the athletic trainer, who's probably the person you're closest with, to
Right.
ask for help, and then it'll just cascade.
Okay. Yeah. So that's a big portion of why we started to kind of hook up too. And I personally want to have a referral source of people that I know and trust, where if it is out of my scope of work to what I'm doing as a coach, and to be like, yeah, okay. And that's kind of part of my assessment or consultation, if you will, of okay, where are you at, where you need to be, and are we talking about someone that's functional here, where I can work with you, or it's the complete opposite, not functional, maybe that depression, there's just stuff going on that's out of my scope of work, that I have a team that I can lead these people to. So I think it's great.
Absolutely. Yeah. No, I think what you do is extremely valuable. I mean, it's like you do goal setting, and like there's a clear, as you said, like a 6 week like manualized model y'all are going to work through, and then you see success.
Mhm. Yeah,
So
no, it's fun. Well, Doc, I appreciate coming on. It's been awesome getting to know you and what you do, and when you get out to Vegas, we'll definitely hook up, and
yeah.
if you ever come out here. So anything we missed, anything that you wanted to cover that I maybe didn't get to?
I think we really hit a lot of the highlights. I mean, the biggest thing is the 5 and 5 mentality is really important, just to know that everybody's going through stress at some point in their life, that we don't want
Mhm.
other people that, you know, oh, they're the ones that have mental health issues, we're going to keep it over here. That everybody's in this together. Getting help is not hard. You just have to know where to ask. It should be not so hard. So just go to your athletic trainer or your team doc. To find out me, so I have my website's peaksportspsychiatry.com, where you can email me at peaksportspsychiatry@gmail.
Okay,
Usually very responsive. I can help you. And if you're not located in one of the states I'm licensed in, I certainly can help as far as figuring out who to talk to that you can get help that way.
perfect. Okay. Well, very good. I really appreciate you taking some time here to come on and educate us on your role and kind of what that looks like. I think that's very valuable. So best of luck to you and your practice, and
Thank
we will
you.
see you next time.
Yeah, absolutely. And I'm super excited. Pitchers and catchers just reported, and spring training snapping and baseball is about to occur.
That's right. That's right. All right, Doc. Take care of yourself. We'll talk to you later.
Thanks, Chad.
Thanks. All right. Hope you enjoyed that conversation with Dr. Mark Allen. I certainly got educated on some of the things he went through. Like we hear the term psychiatrist, right? So I know when I was playing back then, I was like, man, I don't want to see a psychiatrist. Like, what's wrong with me? I don't have, do I something wrong with me? So I'd always question that. So I think he hopefully really alleviated some of those thoughts and ideas that if you ever had something like that, where I don't want to go talk to somebody about my particular problem or issue, you should, right? You should get out there, you should get help. Whether it's just a life coach like myself, somebody that can work with you that's functional, right? If you're more on the, I have some depressing issues, I'm depressed, my anxiety is through the roof. There's different things like you might have to get diagnosed for, right? That's the kind of guy you would go talk to. So make sure you do that. I do want to inform you that I have my 6-week Mental Edge life coaching program. It's been going fantastic. I've been coaching some former minor league players and one big leaguer through this program, and they're actually shocked by really the simplicity of this model and tool that I'm taking them through and how they're starting to apply it in their life, right? You learn something new, at least for me, it's got to be pretty simple. It's got to be applicable and something I can do every day to start getting kind of my thoughts and my mind, my feeling and emotion in the right spot of how I want to show up every day. So if you want to come work with me one-on-one, make sure you go visit my website, mentaledgetrainingcoach.com, or you can even email me, chat@mentaledge.coach, and if you want to inquire and apply for that. So thanks for listening again. Thanks, Dr. Mark Allen, for coming on, and we'll see you guys in the next episode. Take care.